So thank you. We'll go on to the next, Dr. Shafeena. She'll be speaking on Eyespirator, just push, a novel push technique aspiration tool, and this will be discussed by Dr. O.P. Agarwal.
Good morning all. I'll be talking about Eyespirator, a novel aspiration tool. In surgical practice, it is essential to have clear and bloodless surgical field. So the need of suction apparatus is an essential part of surgery. Ophthalmology as a surgical field will have a minimum amount of blood loss, like in cataract surgery, less than 5 ml, in orbital surgery, around 75 ml. But the challenges we faced are the delicacy of the tissue and the small amount of blood, and also in deep socket there will be pooling of blood and fluid, and the bleeding which may obscure the view, especially in orbital surgery which need deep tissue access. Over years, there are various aspiration tools discovered, like angiosterometer, manually operated aspiration tool, electrical suction pump. But the drawbacks are the amount of pressure will be higher and the suction tip are very large, which is difficult to maneuver in small or surgical field. Eyespirator, our innovation is made to solve these problems. It is an easy, do-it-yourself, cost-effective and efficient tool to aspirate small amount of blood, and it can be made using recyclable and easily available components. And it is made using a foot pedal, a DC adapter, a DC water pump, an intravenous set, a collection bottle, and a bottle stand. And how does it work? It works by direct current which is connected by an adapter, and this adapter is connected to a foot pedal which acts as an on and off switch, and this foot pedal is connected to a self-priming motor, and the aspiration end of the motor is connected to a tube which is connected to an opening in the collection tube, which will create a vacuum inside the collection bottle, and there is another opening in the collection bottle to which the intravenous set is connected, which will collect the aspirated fluid inside the collection bottle. The other end of the aspiration tube can be used in the suction surgical field. And we also attempted to try this in the operation theater in orbital surgery. This is the adapter which is connected to a foot pedal, and this is the motor, and this is the collection bottle, and the bottle is a used saline bottle. Sorry. And we could see that the apparatus is effectively aspirating the fluid and blood from the surgical field, which may improve the field of view and also reduce the time of surgery. So the advantages are the surgeon can control effectively. The surgeon can control the aspiration effectively by the foot pedal as and when required, unlike the standard aspiration tool, which is permanently on all the time. And the opening the end of the drip set is very small and flexible, which can be easily maneuvered. And new IV set can be used for each surgery, which may avoid sterilization of the whole apparatus for each patient, and also avoid cross infection. And the entire apparatus can be sterilized by ethylene dioxide, and it is cost effective. The cost of the entire equipment is less than 1,500 rupees. And it can be used for surgeries like cataract surgery, dacryocysto-rhinostomy, dacryocystectomy, excision biopsy, orbitotomy, evisceration. These are my references. Thank you.
What is difference with this our regular suction machines?
One thing is the cost. The regular suction machine costs around 20,000 to 25,000, and this is only less than 1,500. And the tip of the regular suction apparatus is made up of metal, which may get blocked, and it is very larger. And this is simple IV set, which is easily available and it can be easily maneuvered.
With that machine, with that metal cannula, we can attach this pediatric feeding tubes, 6 number, 4 number. That those are very fine, and that can be done with simply available suction machines also. But definitely this is good. If we can get it in 1,000 rupees, is definitely a cheaper version.
Thank you. Yes, Dr. Ramesh.
I am not a cataract surgeon, but why 5 ml blood loss in cataract surgery and why you have to use this in cataract surgery? Because that was the first indication you said.
The main use in cataract surgery is pooling of fluid in deep socket when we are doing cortex aspiration. So most of the time during surgery, the sister tried to mop the fluid with cotton, or she tried to pull it using a syringe. So if this equipment is available, either surgeon or the assisting nurse can easily aspirate the fluid.
So